Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
Hello friends, let us now learn some important points about clonidine. Sorry, not clonidine, clozapine. Clozapine is an atypical antipsychotic. It is an atypical antipsychotic and it is used as drug of choice for treatment of refractory schizophrenia. It is used as drug of choice for treatment of refractory schizophrenia. Okay. So how does it reduce the, it is used, how is it used? So it will increase the glutaminergic transmission because it will increase the glutaminergic neurotransmission. By increasing the glutaminergic neurotransmission, it will reduce the central glutamine levels because now these glutamate levels are just going off. So for neurotransmission, so as a result, it reduces the central glutamate levels, and thus it is used in refractory schizophrenia. Thank you for watching.
Thank you and thank you for watching.